Now, let's have a look a bit more at this new study that suggests care home staff worked longer hours during the pandemic for no extra pay, while some large care companies found themselves able to pay more to shareholders. David Rowland joins me, Director at the Centre for Health and the Public Interest think tank, author of the report. Thanks for coming in, David. Morning to you.
Morning.
It may not be right, but people working extra and not being rewarded for it will not be a new thing to many people. Was there any particular change during the pandemic that you've seen?
So I think it's obviously the case that care workers do work extremely hard in normal circumstances, but during the pandemic, lots of care workers that we spoke to were often living in the care facilities where they were looking after older people, really putting themselves very much at the front line of the pandemic response. And one of the challenges that they told us that they faced was it wasn't just that they were working harder and longer without the adequate remuneration, but it was also the case that they themselves suffered financial hardship in some cases as a result of providing care. And that could have been because of the fact they did more hours, they got paid a bit more, and therefore they didn't get the same benefits. Or they were looking after children or had to have partners who were perhaps furloughed and also not able to work. So the broad context in which social care workers were operating during the pandemic was extremely challenging for them.
And yet there was £2 billion or more of extra government support for the sector. So was that not going to the right places to alleviate that, or did it just need to be more?
So the actual £2 billion that was provided by government, some of it was designed to ensure that care homes could meet the infection control regulations. Other aspects of it were designed to ensure that the care homes maintain their financial viability. Not very much of it really was set aside in order to support the workforce. So there was enhanced sick pay for care workers, but that was not the same enhanced sick pay as other workers in the NHS, for example, got.
You describe in the report the profitability of particularly some of the larger care companies and their ability to pay these dividends to reward their shareholders during this time. Do you think anything should be done now about that?
So one of the really key things that needs to happen within social care is that needs to be much more money going into the system. However, government doesn't currently have a grip on the financial situation of many of the care home companies. There's very little financial regulation that goes on. And so when money does go into the system, government cannot be sure that it won't leak out in the form of dividends and profits. And just to be clear, that's a small proportion of the overall care homes that did act in that way, but it's certainly a concern, and it's something which we pointed out previously that government really does need to get a grip on.
And what about morale amongst the staff? Was there a goodwill that has, I don't know if it's run out or just been run down, that some action needs to be taken to try and gear that up again? Or is it just, as we so often hear, a whole reframing of the system as a whole?
So the interviews that we did with care workers, they often told us the extent to which they'd suffered significant burnout, and they were very keen through our report to make recommendations that would seek to address some of those key issues around support in the workplace, around ensuring that there's decent pay for care workers, because at the moment the care home system is struggling and social care is struggling generally because the workforce isn't there. And many of those people who are working during the pandemic have obviously experienced significant burnout.
David, thank you. David Rowland, the Director at the Centre for Health and Public Interest think tank, the author of that report.
The weather now, which is with